This video is going to be for that new cancer patient, that person that just found out they had cancer and their doctor wants them to start chemotherapy treatment. I want to welcome you to the club that nobody wants to be a part of, but I can promise you this, you're going to get through this. I was diagnosed with stage 4 colon cancer 5.5 years ago. I've had numerous surgeries, including on my colon, my liver again, my lungs, my gallbladder, and even my brain about a year and a half ago. I have personally gone through 60 chemotherapy sessions. While 9 months ago, I decided to stop doing maintenance chemo, I have absolutely no regrets about the time that I've spent in the treatment chair. In this video, I want to tell you what to expect so you can be prepared and informed and confident when you walk through the door of that cancer treatment center. My single most important piece of advice, get the port installed. It's officially called an implanted port or Porticath, and I cannot stress enough, do not rely on a regular IV. Chemo drugs are incredibly hard on your veins. Now, the first couple of treatments, you might be fine, but I promise you, by your 10th, by your 12th session, the nurses are going to be struggling to hit that vein and you are going to be sore and bruised. So, what is a port? So, it's like a permanent hidden docking station for treatments. It's a small round disc, usually about the size of a quarter. So, it's like usually right here on the left hand side of your body. There's then a tube that goes down to a central vein. When the nurses access it, on top of this circle right here, there's like a self-healing rubber patch on top. So they'll stick it. I barely feel the pinch. I've noticed some people do feel it and they get some kind of numbing cream on top of it first, but again, you barely feel the pinch. It's the easiest way to do it. Literally takes seconds and it saves you from countless sticks and countless bruises. And honestly, you barely even notice it. I weighed a lot more when I started my cancer treatments. I weighed 60 pounds more, and you can barely see it. Now that I've lost some weight, it's kind of evident. Well, you can kind of see it sticking out right there. But I wear that as a badge of honor. Um, Cannot stress enough, get the port. Now, will it delay your chemo treatments? Yes. I can't remember exactly, but I know I had surgery. I probably couldn't access it for then 2 weeks, so it delays it 2 weeks. Doesn't matter. I know people hear the word cancer and they want to get treated right away and start the process, but don't rush it. It's worth it. Get the port. So your very first chemotherapy treatment is going to be a little bit different than the others. At least in my case, that very first day I went in and I met with the doctors, I met with a caseworker. They just gave you tons and tons of information, things that the drugs are going to do, things that could go wrong, people that you should call. If you need help financially, like here's some people that you can contact. If you need help mentally, here's some people that you can contact. Just tons and tons of stuff. Then after that, they're going to send you out to the treatment center. So when you're in the treatment center, you're gonna sit in this treatment chair, and this treatment chair is going to be in this pod. And each pod contains, I believe, 4 different treatment chairs. So there's a chair for you, nice little recliner chair if you choose to recline, take a nap. Also going to be like a TV there. I've never once used the TV there, but people do. So there's TVs, you can watch whatever. There's also a chair there if you've brought somebody with you. For the majority of my treatments, I actually went alone until the last couple my wife was able to attend. But either way, so these pods are open. So there's, like I said, there's 4 other people being treated, and the nurse is taking care of all 4 of you. You'll find out that cancer patients don't have a lot of secrets. However, if you're one of those people that want privacy, they do have private rooms, but you do need to ask for those in advance. But I'll be honest, the majority of the people prefer the open setting. I've met hundreds of people. I don't know anybody who would prefer that private setting. I did quite a bit because I worked a lot. I worked remotely while I was going through chemo treatment plants or going through the chemo treatment. There'd be time where I had to be on conference calls. So I would ask for that private room so I could be on those conference calls. But That setting is great because there's so much that you can learn from somebody who's been going through chemotherapy, and maybe there's a couple of weeks in front of you, but they can kind of tell you what to prepare for. But it's also nice just talking to somebody who's gone through what you're going through. So the first thing that the nurse does when you come in, they access your port, hopefully, or they start an IV. So they just hook you up to a normal like saline bag of IV. So once they get that running, then they're going to check your blood work. Typically, you have blood work the day before your chemotherapy, but if it's like on a Monday, then you'll do it on the Friday before. So what they're looking for is making sure your white blood counts are good, white blood cell counts are good, and your platelets. If your numbers are low, they might postpone it. They might give you some kind of drug to increase those numbers, but that's what they're looking at. Once they've cleared that, then they'll send that information to the pharmacy, so they can start you on your drug. So the first drugs that they'll give you is probably your anti-nausea medication. In my case, it was I think it was Catril, and then along with that was a steroid called dexamethasone. So that steroid, what it did is it like boost the power of that Catril, and it also reduces inflammation. It does give you a little bit of a burst of energy, but I'll warn you, anytime you get a burst of energy, there's always going to be a crash. Also for me, anytime that I have a saline IV, it makes me go to the bathroom quite a bit. So be prepared to get up and out of your chair quite often. I probably did it more than most people around me, but probably in one of my chemo treatment sessions, I probably got up 4 times, 5 times maybe. So be prepared to go mobile, and it's fine. Matter of fact, I think you should go mobile. Sitting is bad for long periods of time. Get up and get up often. So after that, so those medications usually take about 20 minutes to run. So then after that, so in my case, I was on the FOLFOX regimen. So FOLFOX is made up of a couple of different drugs. So we got oxaliplatin and levocorin. So oxaliplatin, so this is the actual chemo drug, and what it does, it actually damages the DNA of the cancer cells. This is also the drug that gives you the bad side effects, and we'll talk about that here in a couple of minutes. Now, I know I'm butchering these names. I don't know how to say them. I don't remember. It's been too long, but I took good notes. But Luvacorvin, so that's like a helper drug. It's not actually chemotherapy, but it helps stabilizes the oxaliplatin, which makes it more effective. So that's going to be about a 90-minute drip. So for me, at that point, once they start that, I write down what time it is, and I know, hey, 90 minutes from now, this thing should be over. So that's when I put the earbuds in and just kind of zone out and do my thing for a bit. So when that 90 minutes is up, then that's when they give you the 5FU. So they give that to you in 2 different ways. First, they want to give you a quick shot of it. Like it's a concentrated push that they put right in the IV. That takes about 5 minutes. So that is a one-on-one time with your nurse. So where before, like the nurse is dealing with those 3 other people, whenever she's pushing this 5FU through the needle, through the IV, that's a one-on-one. So for me, if there was ever a time that I wanted to really ask some, personal questions, she's right there, and we can lower our voice and I can ask those questions. So good opportunity for that. So after that push, then they hook you up to this portable IV pump. This is a take-home pump. That 5FU runs for 46 hours. So that pump, I have a love-hate relationship with that pump. Makes it hard to sleep. Between the mixture of the steroids that you just got, and then just worrying about ripping that tube out of your chest, made it hard to sleep. But I will tell you, I've gone through 60 treatments, and I never came close once to ripping that tube out. So obviously be careful, but you'll be fine. So in 46 hours, that pump will alarm, and then you'll go back to the cancer center, or maybe you'll bring in a home health nurse come to do the disconnect. There is no better feeling in the world than being disconnected after that 46-hour pump. I'd finally be able to take a long shower. I'd stretch out. I'd take a nap, I'd roll around with no tubes attached. It's a moment of pure freedom. Enjoy it. Okay, let's talk about some side effects, like some real talk about side effects. Let's face it, chemo sucks, but I promise you it's not the hell that some people make it out to be. If you're one of these people that are thinking about maybe not doing chemo and just letting the cancer take you, trust me, do the chemo. It's inconvenient, it'll knock you down, but it's not that bad. It's only a couple of months. You can get through this. So let's talk about the worst of it. Nausea and vomiting. So I'm not a big medicine guy. And I remember early on, like one time, like saying, hey, let's not take this anti-nausea medication. Let's see what happens. And that exact same day I decided, you know what, I'm gonna take a nap. I'm gonna lay here on this couch. I'm gonna take a 20-minute nap. I regretted that. I vomited about 12 times in about a 2 hour span. And it was bad. It was real bad. Like I haven't puked that bad since I was probably a freshman in college. It was rough. So to prevent that, take your anti-nausea medication. Take it as scheduled. Don't skip it. Stay ahead of it. And probably even a bigger piece of advice is don't lay flat. I took all my naps. I slept in a recliner during treatment, and usually about a day after treatment, and that solved it. Didn't puke since or after that. Also, when I felt a little nausea, get up and walk around a little bit. You're going to hear that quite a bit because I swear that's the answer to everything. Walk around. If you're not feeling well, I know that's probably the last thing you want to do is walk around. Walk around for 10 minutes. Take the dogs for a walk around the house, and you'll feel so much better when you come back. The next bad one was neuropathy. So, that's cold sensitivity. So your fingers and your toes and your mouth, it'll get tingly. It'll be painful. So the oxaliplatin is the one that causes this one. So sometimes some of it can get bad. So here's my recommendation. Number one, don't drink anything cold. Um, Coffee, warm tea, even room temperature stuff. You can feel it hurting a little bit in room temperature. So I would recommend warm stuff. There was one day I tested it. How bad could it be, right? So I think I drank a Pepsi or something, and it literally felt like I was drinking shards of glass. So be careful. So wear gloves, wear warm socks, keep warm. For some people, that neuropathy lasts for a long time. It probably took me about a year, but I do not have any symptoms of that any longer. The next one for me is going to be fatigue and brain fog. So fatigue, there's no real cure for that. I mean, take a nap. The doctor says take naps, so take naps. Embrace that. I don't know about you, but like when I'm feeling good and I have a day where I'm just kind of laying around, like I feel bad because I just laid around all day. But you have an excuse to lay around all day. Do it. Take naps. Brain fog. I think I mentioned earlier that, or maybe I didn't. I through my chemotherapy, I did not miss any work through chemotherapy. There were times where I was doing chemo, like I'd leave work, go do chemotherapy, then go back to the office. Now there were times where I experienced some brain fog, where I was having a hard time like figuring out complex problems. And when you realize those moments are happening, you just got to walk it off. Walk it off. Go for a walk, and when you come back, things are more clear. So that's how you fix it. Go for a walk. All right, the big ones. Let's talk about the bowel issues. These drugs both give you constipation and diarrhea. Both. I know it sounds crazy, but like for the first 3 days, for me at least, it's almost like these drugs that give you kind of like suck all the moisture out of your body, and you just can't go to the bathroom. But whenever it finally does release, then you have diarrhea for 2 days. Um, and there for a while, at least the first set of treatments, I was taking like the anti-diarrhea medication, and that seemed to help a little bit. But I'll be honest, the thing that helped me the most that people don't talk about, maybe because it's taboo, but I invested in a bidet. So I went to Walmart. It's probably $200 spent on a bidet that you can just add to your toilet, and that helped tremendously. The diarrhea was probably the worst part before the bidet. The diarrhea is the worst part is just because of the tenderness that happens if you're trying to keep yourself clean. You're wiping too much, and it's incredible pain. Once I got the bidet, all that kind of went away. So do that. So that's it as far as the side effects are concerned. But the next thing I want to talk about is the mental game. I've always been able to find the good in the bad. I've always been able to figure out how to embrace the suck. That's one of my mottos, embrace the suck. And one of the ways that you can do that is build relationships with the people at that cancer center. Those nurses and doctors, they're a special breed. They see people when they're at their worst and they're trying to save them. Get to know them. And you know what? Not just the nurses, but the receptionist and the people cleaning the rooms. Get to know all of them. That human connection really makes each visit easier. I look forward to it. I look forward to hearing how Amy's last vacation went, or what the last concert is that Tyler went to, or whatever. Just enjoy those people. Also, save some of your fun stuff for those treatments. So what I mean by that is, one of those drugs that I was given, it was a 90-minute drip, right? And I said that I would put my earbuds in and just kind of check out. I love comedy. I love stand-up comedy. So I would make sure, hey, Shane Gillis just released a new comedy special. I'm going to save that for Monday's treatment. So while everybody around me was just absolutely miserable, I'm laughing my butt off, trying to contain myself because some joke that Shane's saying, or Joe Rogan, or whoever. So save those moments for the treatment center. And in addition to that, whatever Netflix series on, I would wait until, like, hey, I know if I'm having treatment on Monday night, I'm not sleeping, so I'm going to watch 5 years ago, the Ozarks. That was a big series on Netflix. I'm going to make sure that on Monday night I'm watching back to back to back episodes that night and just enjoying the night. So, in addition to that, enjoy the fact that you can just lay around and take naps. That's uncommon anymore. So enjoy that process. And probably my favorite thing about cancer, if there is such a thing, my favorite thing about cancer is the ability to reconnect with people that I haven't talked to in a long time. When you get diagnosed and people know that you have it, they're going to reach out and just say, hey, thinking about you. It's just, I don't know, it's just a cool way to be able to reconnect with people. So, all right, let's end this thing. But I want to say, you never know how you're going to react to a situation until you're thrown into it. So here you are, you're in it. How are you going to react? You are stronger than you know. You've got this. If you need me, reach out.